Medical reporter Liz Bonas has the latest on hot flashes in today's health headlines.
I should say the latest news as opposed to actually experiencing them yet, but guess what? Some important news for women in menopause. This one really interesting. The North American Menopause Society says that its latest studies show the best way to actually tame the hot flashes is without hormones. It's through cognitive behavioral therapy, or therapy that changes the way women perceive their hot flashes. The study also found some non-hormonal prescription medications such as Paxil can offer mild to moderate relief. And believe it or not, what did not work, which was really surprising, exercise, yoga, and acupuncture. We've all tried them. And new research suggests people who fidget when they are sitting may counteract the adverse health impact of sitting for long periods. UK researchers found no increased risk of mortality among people who considered themselves moderately or very fidgety, just burning calories. September is Ovarian Cancer Awareness Month, and a new study from MD Anderson cancer researchers shows a medication that's commonly used for patients with heart problems may help survival with this cancer. We asked the experts at TriHealth to explain why this might be true in today's Medical Edge. Debbie Walter has a lot of motivation as an ovarian cancer survivor to get the word out.
And I just really want to get out there and create that awareness of ovarian cancer.
Now, this new study shows more progress in understanding this cancer. Researchers looked at two groups of women. One group took beta blockers, normally used to treat high blood pressure. The other did not.
And what they found is that patients that were taking a beta blocker actually had better survival than patients that were not.
Dr. Kevin Schuler is a gynecologic oncologist. He told me the benefit to patients may come from how it alters what gives your body sort of a stress response. That fight or flight, we call it. It has to do with adrenaline.
If you think about adrenaline, it's actually an anti-adrenaline. It slows your heart rate down, it slows some of the body processes down. We think that many ovarian cancers actually spread and grow through stimulation of these fight or flight responses that are always on.
He stopped short of saying that we should actually be taking these medications now with ovarian cancer treatment, or any other for that matter. But he does say this is one more reminder that when it comes to cancer, we are treating a whole person. That means the things Debbie does to manage stress, such as playing tennis or building a strong support system, might also help her fight this cancer in a similar way that these medications work to alter the body's stress response.
If we can control our stress and control our stress responses, that may be beneficial.
You know, it is so interesting that stress seems to make a difference. By the way, some common brand names for beta blockers, low pressor, Corguard, you probably have heard of many more. I do know that we think now that stress may play a role in the disease state as much as smoking or obesity.
Wow. I believe it.
Yeah, it just changes hormones in the body. So just a little thing that we all might want to pay attention to. You can't change the stress, they say, but you can give yourself an outlet.
There you go.